All right, welcome back. The show is interactive. We want to hear from you. If you happen to be living in the Wa municipality or anywhere in the Upper West region in particular, we'd love to hear from you. You know, your thoughts on the issues that we're talking about here, and you know whether you've fallen foul of some of these incidents before. We would definitely want to hear from you. So use the hashtag Breakfast Daily. If you're watching us on social media, if you happen not to be watching social media, you can send us a WhatsApp message as well, 0550585832. Now, we're going to go into to Bimbilla. Now, Bimbilla, this hospital story is something that we have discussed, before, but there's another angle, or a twist, I should say, to this story. Right now, they're having challenges with water. Now, what's the issue? Ghana Water has cut them off. You don't have water supply anymore because they're owing. It's a problem. Now, we have some conversations that we want to play back to you with the administrator of the hospital, as well as one or two others. Now, I'm not sure, what it's a government hospital. Mm-hmm. It's not a private institution.
Yeah.
So I actually struggle to understand who takes such a decision to say that a primary health care provider should go without water because they owe.
But they have to pay their bills.
Yes.
Because we're here when ECG disconnected some government institutions.
Yes.
And
but
all that.
We also know that in terms of the ecosystem that we live in Ghana, right? There are people who still are running on power, and but they're owing. In Bimbilla, look at where the government hospital is. The conversation we've had before. Yeah. They are the only health provider for about, I think, 65 communities or something like that. Yeah. To cut them off, and I don't say they shouldn't pay their bills, but to cut them off, I'm not sure if we understand what we're doing. Water is one of the most essential things for a health facility. But you remember the conversation that we had about COVID?
Yes.
And the importance of running water.
Fantastic, yeah.
So what are they hoping to do? That we should have a health crisis?
So the ministry should step in. Somebody should get up and say that, okay, we are going to pay the bills, because if we also have to supply water, we also need to make account for that. We also have to pay for that,
I don't disagree with you.
Exactly. So I also get where you're coming from, but this has become a challenge, in as much as we are expecting services, for some of these hospitals. How are we also equipping the service providers to make sure that they are also able to discharge their duties effectively? You get it? Yeah. Yeah. So this has always been my issue of paying attention to what we deem and priority, in terms of our everyday lives. Yeah. So if we think that healthcare delivery in Bimbilla is so key, if we think that where the Bimbilla Hospital is, it serves a number of communities. If they don't have water, if they don't have electricity, this is going to happen. What are authorities doing about this to ensure that there is constant flow of water? Yeah. There's uninterrupted electricity supply, So this is, I think, that where the hospital finds itself, and this is where Ghana Water also finds itself. But there's an interview that we had, so let's take a look at this.
We are students, nurses, and we are doing our clinicals here. And there's no water at the hospital, so we want to go here and see if we get water at the police station. It's been about 3 to 4 days today. We've been suffering from this problem. It delays the time we used to go to work, because you have to wake up and go and search for water before you bath and go to work.
No water in the hospital. In fact, without this water, we are suffering a lot, because we have to go to work around 7:30. And because there is no water, you have to go around and search for water and come and bath before you go. And we've been going to work late. We pray that the water suppliers will come and help us.
Yeah, we find it difficult in getting water when we are doing operation. Even when we doing dressing and other things, even washing of our hands is a problem. So we'll pray with you if you can help us to get water.
So muka tizanga adabai to komna tan kuto le yang china la kutazang sino so you cannot go for ma la fe ama komi be chema dare.
Yes. Okay.
Our water has been disconnected. Okay. I was told this morning by the theater staff that there was no water in theater. So when I arrived there, I got to realize that the water supply to the theater and labor ward has been disconnected. And as a result, cases that were scheduled to be done have to be referred. So currently, as we speak, we are unable to perform any surgery because of lack of water. Yes.
What is the reason for the disconnection?
You know, the reason is that the Ghana Water and Sanitation Agency, is it Community Water and Sanitation Agency? Yeah. Yes. Said we are owing them. Okay. And the hospital is owing them over 220,000 Ghana cedis. In fact, the very day I took over the management of this hospital, that was somewhere, I guess last year. The following day, they came and disconnected it. So this is the second time they have done that. Okay, and I think that the situation needs urgent attention. Because we cannot continue with this kind of, erratic water supply to the hospital.
Doc, if you don't pay your water bills, how will you?
No, the issue is that, this is a public facility. Okay. And, some time back, facilities were made to present the utility bill to the central government. So the assumption was that the central government was going to take care of that.
Okay.
Okay. Yeah. So I don't know. The situation in this district is a bit worrying. I have to be frank with you. It's a bit worrying.
Okay.
Okay. I've made several attempts to engage the manager here, but when you call, he doesn't pick his call.
Wow.
Okay. So there's nothing I can do.
All right. So that's a conversation that we had with the administrator and a few others in the hospital. There's some student nurses and so on. But yeah, it's rather disturbing. From so I understand, the angle of the bills are accruing. They need to be paid because Ghana Water also cannot run at a loss. Yeah. Right. Of course, they are already, heavily burdened with debt anyway as it is. But then this is also a health institution. And of course, our colleague, Mohammed Alabira, is joining us on the line. Mohammed, good morning.
Good morning, Alaji.
Yes, how are you?
I'm doing well, sir.
Fantastic. Thank you for joining us this morning. Now, this situation in the Bimbilla Hospital, let's get some context for this. How long has the hospital been without water?
Thank you very much, boss. For this particular issue, today is the third day that the hospital has been disconnected from from water supply. But the issue is a long story. As you earlier said, this is the second time we are talking about Bimbilla Hospital water problem.
Yes.
But since the establishment of the hospital or the conversion of the Bimbilla clinic to a hospital is about 15 years ago. Since then, Bimbilla Hospital does not pay its water bills. So it means that the current debt that the company disconnects the hospital from is for 15 years.
Wow.
Yes.
15 years. That will be running into millions, I would imagine.
Yeah, the debt is about 220. It's over 220 Ghana cedis.
220 million Ghana cedis.
Yes, 220,000 Ghana cedis.
220,000 Ghana cedis.
Yeah.
Okay.
Yes, please.
Okay.
Now, who is supposed to pay this debt?
Yeah, that's the challenge here. My conversation with the medical superintendent of the hospital was he indicated that central government was or is supposed to pay the water bill. But my worry was that so if central government is not paying, what is the hospital doing? Can't it so do something to restore the water?
Yeah.
I remember the first time it happened, there was that discussion between them, the district, the municipal assembly, and then the water board. They came to an agreement that they signed an agreement that monthly they will be doing something. But it is also right to mention that it wasn't this particular medical superintendent who was there. It was his predecessor who was there. So he signed that agreement. I don't know when when he came, he saw those agreements or not. But since he came, the hospital is not paying any bills, and that has led. Listen, this morning I had a conversation or a chat with some of the water board people, and they tell me that they are now also under different management, which means that if at the end of the month they are not able to meet the target set for them, workers there are not paid their salaries. So for 2 months now, they have not also been paid their salaries. So they also now want to do everything possible to go after their debtors so that they could meet their target and be paid their salaries. So that is why they have also gone to the hospital to disconnect it, so that when they pay, then they will also meet their target and will be paid their salary.
Now, Alabira, with all these happening, have you been able to speak with the regional health directorate or the district health directorate to know the way forward?
Yes. I spoke with the manager, and he tells me that the debt is huge, and the agreement that they signed for 6 months or almost getting to a year now, the hospital has not shown any commitment to that agreement. So they don't also know, and they cannot continue also to be running on this. So they also have to take some steps to refund their money. So that is why they have also gone to disconnect them. That is what the manager of the water system told me on the service. Yeah.
Have you heard anything from regional health directorate, from district health directorate, and does it look like the hospital can pay this money, even if it's broken down, for them to make some kind of commitments every month?
Yes, for now I have not been able to get in touch with the regional director, but I spoke with the the municipal chief executive this morning, and he also told me that he has asked that tankers to be supplying the hospital water for now for them to see what will happen going forward. But paying the bills, I don't think the hospital is in a position to pay its bills. The hospital cannot pay these bills if nothing is done urgently for them. Relatives of patients, they go to the hospital with cans, gel cans with water. If the worry is that people coming from outside, because Bimbilla Hospital is at the center of the Eastern Corridor, and it serves about 3 or 4 districts, including Nanumba North Municipality itself. And if this patient has come, Madam, I don't know what will happen to residents here.
Anyway, thank you very much, Alabira, for this update. Right, so this is it. This is the story of the Bimbilla Regional Hospital. As it stands now, for the past 3 days, they have no water. And this is a hospital that we are talking about. So you can imagine what is going on. Now, their debt runs to hundreds of thousands, over 200,000. And according to Alabira, the hospital is not in a position to pay this debt. So what happens from here? This is a very sad development. So David, this is where we are as a people. So all the communities who depend, on, and I mean, for a hospital not to have water or electricity, then you might as well just stay home.
Yeah, I mean, what are you going there for? It's a death trap. Yeah. I'm also wondering, I mean, I don't know what the water table in that area is like, but the amount of money that they're owing in terms of the, the debt that they're owing the Ghana Water can build several at least 10, 15 boreholes.
Yeah.
You know, so I'm also wondering the decision-making process.
Yeah.
You know, because some of these things, if 10 years ago, 15 years ago, when drilling a borehole was like 8,000, 10,000 Ghana cedis, you know, if they had dug boreholes, you know, maybe 2 or 3 at the hospital, we wouldn't be discussing this matter now, you know. But then again, I'm saying, I don't know what the water table situation is like.
But why did we also decide that for about over 10 years we will not pay the bills monthly? Yeah. You know, because if you are paying monthly,
it's easier.
It is easier. Yeah. It's not so huge, you know. Yeah. But for you to sit down over 10 years bill, come on, there's no way the hospital can find some 220,000 cedis to go and pay. And now I think that we need authorities to step in, you know,
but
to have some kind of...
the same hospital we're discussing about the maternity ward issues.
Exactly,
and
everything
and
about
they don't even find money to deal with that problem. How are they going to pay 220,000?
You know, sometimes this kind of conversation really gets tiring and frustrating, you know, because we are always talking about one thing or the other. These people don't have proper infrastructure now, they don't have access to water. And we are talking about a hospital where people have to go to lab, where people have to take samples of urine, of, I mean, everything, you know, and you don't have water. So you go to the hospital, look at all the ailments that people are coming to hospital with. So you are coming back home probably with different ailments, you know. So for now, the agreement is it is the responsibility of central government. So what is the government doing?
But government seems to be owing a lot of people, though.
But why is government owing a lot of people? Because the thing is, if you break it down, okay.
Why is government owing a lot of people?
And every month, we pay something. So we are looking at maybe if we even have to pay like 5,000 cedis, 10,000 cedis every month. It is easier than sitting down for these bills to accrue. And we are calling you and you are not picking. Yeah. And you feel that somebody is disturbing you because you want your peace of mind. This can happen, you know, because if you put yourself up for public service, know that it is public service and you are at people's beck and call. If we call you, respond. The least you can do is to find something, you know, heartwarming to tell people and tell them that you are going to deal with the problem. But you are not picking up. You are not saying anything. People are dying. People are sick. They need to go to the hospital. Now, if a pregnant woman goes to the hospital, somebody in labor, and there's no water, what is going to happen? If people have diarrhea, and they go to the hospital, there's no water. What is going to happen? I mean, we can't be doing these, you know.
Well, we have Issa Sugri, who is the manager of Bimbilla Water Systems. Let's talk to him now. Good morning, sir.
Good morning.
Yes, welcome to Breakfast Daily.
Oh, thank you.
All right, so it seems rather heartless of the Ghana Water Company to cut off a hospital that serves in the region of about 65 communities from water. What, after 15 years of not paying their debts, we understand it's about that old. Why now?
No, I disagree with the statement that it's heartless.
Okay.
It's because of the issue that the woman just narrated. That is the reason why we are even disconnecting them.
What's the reason?
It means that the hospital needs water. And then the system also needs to run sustainably. If you look at the hospital and other institutions, we prioritize them. They are priority customers. They are connected directly to our transit. And then they receive water first before any other customer.
Okay.
And then currently, we are rushing the water. The water is not even enough for the whole of the community.
Okay.
And they consume close to 30% of the water that we produce.
I see.
So if they are consuming and then they will not pay, will the system be able to run sustainably? No. So there will be a point, it won't be only the hospital. The whole of the town will be cut off.
Okay.
As we speak now, we have a pile list of warning letters given to us by NETCO. So we also need to pay for operation.
Okay.
So if, and then we have been engagement with them for almost 3 years now.
I see.
The last time we met, we agreed that, okay, the money that you owing us is huge. So they agreed that, oh, they will, while they are working to pay the debt, then they will pay in the current bill. Are they doing that? No. And then before we even sit down to have a conversation with them, we have to disconnect.
So you're saying that
when I send them a reminder notice and a disconnection notice, did they respond? No.
Okay.
So how do I get them to sit down and then discuss?
Okay.
Or they will never pay a bill.
So Mr. Sugri, you're saying that
yes, please.
Apart from the paying their debt, you've also asked them to just start paying their current bills, and they are not doing that either.
Yes. Why they try to mobilize and then do something about their debt? Just try and paying the current bill. That was the agreement we made somewhere last year.
Okay.
And then after that, how many months have they come to pay current bill? No.
I see. Okay. And can you give us a sense of how much the current bill is? When I say current bill, I'm talking about like an average of a monthly bills, average monthly bill. What's it like?
Average is 1,300 Ghana.
I see. Okay. All right. Thank you very much, Mr. Sugri. We really appreciate your time. Thank you.
So you see, if we are paying 1,300 cities, less than 1,500 cities, why is it difficult for the central government?
For the entire hospital?
Responsible, you understand? Parliament owes ECG, MMDA's OECG, airports of all places, OECG. Now the Bimbilla General Hospital has been disconnected for owing, to the tune of hundreds of thousands of Ghana cedis. Why are we doing this?
And Nanumba North Municipality MC, I don't know why you're not picking our calls. You get
it. And then now some administrator at the hospital is the one to bear the brunt. Why do we put people, through this? It is so unfair. And of course, it is also unfair to the service providers. Wow. Because they have been given water. Look at for how long bills have not been paid.
And 3 years ago, when they started the conversation, they've held back. They don't want to cut it. They don't want to cut it. Then they come into a conversation again a year ago. They still don't want to cut the lines. And it's like looking for different ways for you to pay so that we can just keep you on.
Because for me, if Ministry of Health is watching, if the central government is watching, does it look like the Bimbilla Hospital can pay this debt?
We can answer for them. They are not going to pay the debt, so you have to pay.
Well, if you won't pay it, you just sit down, let the people die, if that is what we want, because Charlie, we are tired. If you don't pay, it's okay. Whatever you want to do.
No, but it's completely unacceptable that we should find Ministry of Health, Ministry of Finance, the
Ghana Health
Service, all the different layers of this conversation that we're having here. You're not doing what you should do. And it's unacceptable. Is it because it's Bimbilla? Is it because they are far away from central government?
Come on.
Really?
And look at the number of communities that this hospital is serving. Yes.
Well, from the last conversations we had about the communities that it serves, about 65 communities, and honestly, it's a disgrace.
These things are not cool. They are not
it's
cool.
A disgrace.
Honestly, it's not cool.
Whoever is the ultimate,
you should be embarrassed,
ultimate person in charge, you should not be able to even go to sleep tonight, honestly, seriously. We have the Nanumba North MCE on the line, Mr. Abdullah Yakub. Good morning, sir. Sorry, it's rather the medical superintendent that we have on the line for the hospital. Dr. Adams, good morning.
Good morning.
Yes, how are you doing this morning, sir?
I'm doing very well, and you?
Very well, thank you. Welcome to Breakfast Daily. And just a quick, point on this conversation that we're having here. As the medical superintendent of the hospital, what is it that you can possibly do within the remit of your responsibility to help this situation?
Thank you very much. I'm so impressed about you trying to contact me to know exactly what we can do. But this is a situation that we have inherited. Okay, I think the water challenge has been on for some time now, and my information is that the bill that has been presented to the hospital is a bill dating back to 2004. So roughly it's about 18 years old. Okay. Since the hospital was built in 2004, the bill has been coming. And our understanding was that the central government was taking care of this bill.
Okay.
Okay, I have worked in about 5 different hospitals in the north. I have worked at Tamal Teaching Hospital, I have worked at Tamal West Hospital, Kaga Hospital, and Bushegu Hospital.
Okay.
I have never seen a situation that I'm seeing in Bimbilla Hospital. You get my point?
What do you mean by what you're saying? You have never seen, as in...
What I'm saying is that, you know, the zeal with which Ghana, Community Water Company, and then the NETCO, the zeal with which they come to the hospital and be doing the disconnection left, right. I have never seen this happening anywhere I have worked before.
But
okay, and we have tried. You see, since I took over, I tried to engage the authority of the community water and sanitation and see how best we can bring it closer to this particular problem. Okay, and to the extent that we have, you know, discussed it at the regional level, regional health directorate level, and just last 2 weeks, when Ghana Health Service Council came to the region, it was one of the issues that was discussed at the regional health directorate. Okay, and we're assured that, in fact, an immediate solution will be found for this. Only to be disconnected just about 3 or 4 days ago. As we speak now, yesterday we had to cancel 7 elective surgeries.
Wow.
Okay. Yeah, we had to do that.
Right.
We didn't have water. We didn't have water to operate.
Doctor, when you had your engagement with the Ghana Health Service, what was the agreement? Did they assure you that they were going to pay the debt, and moving on, they were going to pay the monthly bills?
You see, what happened was that, okay, this was a council that was on a regional tour. Okay, so as part of the problem of the hospital, we articulated it at a meeting with the council. And the council assured us they were going to take the matter up and ensure that the issue is resolved.
Right.
Since I took over, I have written about 2 or 3 different checks to this particular water and sanitation agency.
Okay.
Okay, as a way of helping to address the situation. Okay. You know, coming to disconnect water supply to the hospital is not a solution to the problem.
Right. Now, you have not had water. The hospital has not had water for about 3 days now. What has been the conversation between the central government and the hospital, management of the hospital? What have you spoken to the central government about this?
You see, what happened is that attention was drawn to this disconnection just the day before yesterday. And yesterday, I had to go and meet with the municipal assembly. Yesterday, in the morning, we met at the municipal assembly with the municipal coordinating director.
Okay.
This morning, I have spoken with the district chief executive. Is that okay? I mean, we don't do things that way. If you have an issue at hand, what we need to do, we need to intensify collaboration and then stakeholder engagement.
Right, Doctor.
As a way of addressing the issue.
Yes. So when you spoke to the regional authority, you know, what was the agreement? Are they going to, because since they have to pay the debt, are they going to engage the water company in the area to kind of, you know, have a certain kind of payment plan so that a hospital can be put back, you know, to the service and get water? Has this gone on?
As the head of the institution, I have gone some steps ahead and written about 2 different checks to Ghana Water, to Community Water and Sanitation.
Checks from the hospital.
Efforts are made to address the issue of the accumulated debt.
Okay.
Yeah.
Okay, so that we don't continue to compound new debt to the old one.
Okay.
Okay, in fact, what is going on, what I'm thinking is that I think it's just an abuse of power and authority.
On whose part?
Yeah, on the part of the water, community water and sanitation.
Okay, Doctor, so according to them, they also need, you know, money to keep providing the service to the hospital and to other consumers of water. So what is going to happen, you know, in that regard, in terms of making sure that the monies are paid?
Yeah, of course, we need money to get service rendered, but that is not the way to go. Okay? The way to go is to what? Intensify engagement and ensure that at least the relevant authorities concerned are brought on board to ensure that the issue is addressed, but not to come and disconnect water supply to the people. It is the right of the people to ensure that they get access to quality health care. It's an infringement on the right of the people we are serving. Okay, I think this is unacceptable. Okay?
Right.
We don't do things this way.
Right. Right.
How do you come and disconnect water supply to a major facility serving, not less than 230,000 people?
All right.
As you speak, had it not been the intervention of the coordinating director, who was a patient last night.
So you said
at 2 a.m. we had a referral case who was a sickle cell patient at the same time in labor. Okay, so they had to temporarily give us a tank full of water to be able to address those emergency issues.
Yeah. So Doc, you said that you've written 2 or 3 checks. Give us a sense, just a rough idea of how much, to the tune of what amount, are we looking at to sort of offset the debts that you owe?
You see, currently, as we speak, the bill is around 222,000.
Yes, we understand that. Yes.
Right?
Yes.
Okay, and on our part, we said we don't want to continue to accumulate new debt to the old one.
Yes.
So after when the new one comes, we, the management of the facility, ensure that we try to clear the new debt.
Yes.
Is that okay? So that we don't continue to pile on new one to the old one.
Yes.
And we intensify effort to ensure that the accumulated, debts are paid off.
Yes. So how much have you paid so far in terms of the checks you say you've written?
We've written about 3 checks to them.
Yeah.
And
how much is everything in total? So for instance,
the issue is that I think the monthly bill is around 1,000. It varies 1,000, 5,000, 8.
Okay.
Right?
Yeah.
So we have paid about 3 consecutive times.
Oh, okay. All right. Okay.
Yeah.
Okay. Thank you very much, Doc. We appreciate your time.
Yeah, you are most welcome. And just to add,
go ahead.
In fact, I want to state categorically that when people are put on offices, when people are entrusted on authority to say, there's a need to always ensure that whatever actions or inactions or whatever action you want to take, you should always ensure that the life of the people are not affected.
All right.
Okay.
Okay.
I was telling the manager of Community Water and Sanitation Agency in Bimbilla.
Yeah.
Today, it is somebody who is in the hospital. He's not there because he wants to be there.
Yeah.
Okay, he's there as a result of ill health. You don't know what will happen to you in the next moment.
You're right. Right.
So let's ensure that whatever thing we are going to do, we should ensure that at least the life of people are not affected.
Right. Thank you very much, Doctor, for your time this morning.
Thank you.
Right. Yeah. So, no, I understand the emotions of the doctor, I understand where the service provider is coming from. My issue is...
But the manager of the water system said that at least pay your current bills. And he said, the doctor is now saying that they've issued 3 checks for the current bills.
Have they cleared?
That
we did not ask, So maybe we've given post-data checks. Maybe we've done this and that and that. My issue is, David, if the central government says that we are responsible for the payment of bills, central government must pay. I mean, it's as simple as that. How difficult is this? So just make sure that, because if you also consider this a priority, there are people who do not, look at Bimbilla Hospital, for crying out loud, you know. And my issue is, why are we here? This man didn't just come, So, I mean, he just came. So the problem has been there for God knows how long.
Years plus.
Why are we not paying this over
That's
the
like
years?
18 years.
You understand? So central government, it is your responsibility. Just deal with your responsibility.
Yeah, it's as simple as that. Well, let's take a quick break and we will be right back.